It's a pleasure to be here. Thank you. My name is Mindaugas Galvosas, and today I'll be speaking about the validation of the Hyfe CoughMonitor. For disclosure, I am an employee at Hyfe, and I'll be speaking briefly about the Hyfe CoughMonitor, and I'll be spending the major part of my presentation speaking about our validation study. So from annotation to event-based, rate-based, and subset analysis. The Hyfe CoughMonitor is a smartwatch device right here on my wrist that timestamps cough while being worn during the day and while charging at night. It is intended to quantify coughing by passively detecting and timestamping coughs, which are reported as cough seconds per hour. The primary objective of our validation study was to assess the overall performance of the Hyfe CoughMonitor when used by individuals with problematic cough of any etiology during activities of their daily living. Our inclusion criteria and exclusion criteria seen on the slides for the validation study enrolled participants who are adult, 21 years or older, with problematic cough, and who were willing to wear this Hyfe CoughMonitor smartwatch on one wrist and an audio recording smartwatch on the other wrist for 24 hours. For such study to be valid, it is extremely important to have well-annotated continuous audio recordings to be used as the ground truth comparator. And we take annotation extremely seriously, from 31-page SOP for training and testing the labelers to analyzing their outputs. So for our validation study, continuous audio recordings were split into 30-second snippets, which were annotated by two blinded trained annotators using our proprietary audio visualization and data entry software. When annotations differ or are offset by more than 100 milliseconds, they were considered discrepant. And such discrepancies, because of timestamps or because of the value of the label, were then sent to the third reviewer for adjudication. So this is a very important slide. Peter Dishpinigitis tells me that whether coughs or cough seconds should be the unit of analysis in quantifying coughing has been a topic of conversations among some of you for the last 16 years. And to address this question, we have conducted an experiment where 40 hours of continuous audio were annotated twice by the same labeler, as seen on the left side, and by different labelers, as seen on the right side. So on the x-axis, we have the first round of annotation, and on the y-axis, we have the second round of annotation. As you can see across these four panels, both coughs and cough seconds correlate highly in both intra-observer and inter-observer agreement. However, as you note with these red difference indications, the line of agreement falls closer to perfection when using cough seconds. And in fact, our data shows that annotators disagree 40% less when annotating cough seconds versus coughs. Therefore, cough seconds is a more reproducible ground truth, which I'm going to use for the rest of my presentation. So for analysis, the event level metrics and rate-based correlations were calculated, and I'll be presenting both linear and blunt almond plots. To date, we have analyzed the data from 16 patients, totaling 377 hours of continuous audio and almost 6,000 cough seconds. In this graph, we see the number of cough seconds per each of the participants, ranging from 48 to 830 cough seconds per 24 hours, allowing us to evaluate our performance in both low frequency and high frequency coughers. This slide shows event-based cumulative counts over 24 hours. We have For each of these 16 panels, on the x-axis we have time, and on the y-axis we have cumulative cough seconds. Humans are depicted in black line, and the Hyfe CoughMonitor results are depicted in red line. If Hyfe was perfect in each of these lines, in each of these panels, the two lines would be perfectly aligned. As you notice, it is not perfect, but we are pretty close. This slide shows event-based sensitivity and false positivity per hour. We have the false positives per hour on the x-axis and the sensitivity on the y-axis. Each black dot on this graph indicates an individual study participant, with the average sensitivity and false positivity rate of Hyfe indicated with the red X. The sensitivity range from 75.2% to 96% with an average of 88.4%. Our false positive rates per hour range from 0.5 to 2.2 with an average of 1.1. You know, evaluating sensitivity and specificity for every event, it's crucial when you evaluate a diagnostic test, since every patient result matters. But that's not true when evaluating an event counter, such as a step counting device. We don't ask whether a patient made a step at 6 past noon. What we are interested in is their overall activity and the step counts over the hour, the day, or some other time period. Similarly, what matters to both patients and providers is the hourly cough rate and its dynamics. This slide shows rate-based linear correlation. We have cough seconds per humans on the x-axis and cough seconds per Hyfe on the y-axis, with in total representing 377 person hours, each dot being 1 person hour, different color representing different person. The black solid line is the line of perfection, and the black dashed line is the Hyfe line of best fit. The Pearson correlation between hourly counts is very high at 0.991, with a slope of 0.91 and an intercept of 0.84. This is just another way of presenting the same data, which is preferred by some people and confusing to a lot of us. Overall, Hyfe correlates very highly with human annotators. We were interested whether Hyfe performs equally well across different subsets of coughers. This slide shows subset analysis by sex, disease, and country. We understand the numbers are small. However, for females, males, Spain and US depicted on the top row, and a variety of diseases depicted on the bottom row, we see that there is no objective difference among these subsets. In conclusion, we have established, documented, validated, and are publishing a rigorous annotation protocol, which I'm more than happy to share with anyone here. Based on our data, annotators disagree 40% less when annotating cough seconds versus coughs, and therefore we are using cough seconds as the ground truth comparator. Thanks to this study, Hyfe's performance was shown for event-by-event basis to have the sensitivity of 88.4% with 1.1 false positives per hour, and Hyfe's performance in coughing rate basis had the Pearson correlation of 0.991. Thank you.